The center is a place where we welcome refugees and asylum seekers, people who fled their home countries due to war, persecution, and it becomes an entry point for them to start to find a place to be able to stabilize and start their lives in many different ways here in the U.S.
Our clients range from individuals who are farmers, illiterate, no education, to those who are professionals from their home countries.
When people think of refugee populations, often we think of millions of people, but we have to really bring that to the level of the individual. And when you begin to do that, you begin to see the depth and breadth of really what they've experienced and what they've lost.
Housing is a major problem for most everybody I see, but other social and financial issues weigh heavily as well. Transportation, food, security, clothing.
It's all about being an exceptional care provider to patients who may otherwise lack access to care and may otherwise fall through the healthcare system.
We benefit as a program so much from being embedded within Boston Medical Center because we can walk somebody down to the emergency room.
BMC is unusual in having a food pantry on site.
So we can have someone come here looking for help that first day and they can leave with food, which it's not like that at every hospital.
So what we help them do is get to the next step. We do workshops, leadership training, we provide education, one-to-one counseling.
It's really unique, in this region, in that it provides essentially comprehensive care, both regarding medical issues, regarding psychiatric issues, social, financial, and it ties all those together in a very holistic way.
A large percentage of our clients come from Africa, but we do see people from every region of the world.
They're probably in some of the worst circumstances that a human might find themselves. They come here not knowing anybody. They typically have no financial resources. They're frightened. They're typically afraid to even attempt to access resources, partly because they don't know what the risks might be as far as potential deportation, for example.
We assess their housing circumstances, their legal circumstances, particularly if they intend to seek asylum in the United States, of course their medical and social needs, as well as their psychological symptoms, in an effort to really meet them where they are.
Many of the women that we see for prenatal care are actually pregnant as a result of rape and are coming to us carrying that trauma with them from the experience that they had in their home country.
Most everybody I see has major depression, has PTSD. Many people suffer from chronic pain.
I definitely gain strength from watching and learning from these women who have gone through such horrifying and incredible journeys to get to the place where they are.
So I was working with a young woman who was fleeing an abusive home as well as an experience of torture and rape in her home country, whose mother went through extraordinary measures to be able to get her out of the country. And when she was saying goodbye to her mother gave her a necklace and said to her, someday you will find someone who will protect you, and when you find that person, I want you to give them this necklace. And she bought the necklace in the day she told me that story, and she gave it to me and said, I found protection here at Boston Medical Center, and I want you to have this necklace that my mother gave to me.
It's actually very humbling, in part because of all that people have suffered, and frankly, many are just so inspiring. They continue to have courage and they continue to fight for a future.